holding here has the potential to help save 10 million lives.
Unicorn Hunters.
Esta hora hablamos de Unicorn Hunters.
Unicorn Hunters is looking for that next billion-dollar idea from entrepreneurs.
We're searching for that billion-dollar business, a unicorn.
RUV Technologies has developed Krypton disinfection lighting.
Forte is a tech company that enables gyms to create a digital experience.
The CVAC system is an air vacuum chamber.
Mechanical trees solve climate change.
Our technology now has the ability to predict health outcomes and save lives.
What concerns me, your lack of ambition. 70 million in 3 years, that's not much.
I love supporting small business, but is this a big enough market?
To what degree it's a personal cost for you, and to what degree it's business? Why aren't you already a unicorn?
Your gross revenue was $126,000. How are you going to increase that for 2021? Do you see yourself on the acquisition path in the near term, or do you prefer to take this company to IPO?
That out-of-pocket cost is not a reality.
This is the time of our lives.
Order! Order!
This show has a very good chance of changing the world. We got to get down to business.
You'd actually make rather a good prime minister.
I think we're looking at the next Elon Musk.
Everyone is going to benefit.
I must show you one more thing.
There's more?
This sounds like a labor-intensive business model.
Why are you doing this? So what's your why?
How many women work at Fast Minds, and how are you including them?
I like a lot of things about it.
But before you get too cocky,
I don't know if people are going to invest.
This didn't go as expected.
The best presentation I've yet to see at Unicorn Hunters, by far.
thank you so much. Muchas gracias.
I'm in.
I'm definitely in.
And I'm going to invest.
Let's go, Nick! Let's go, Nick!
Can we call my mom? What I'm holding here has the potential to help save 10 million lives.
Wow.
Hi, my name is Mihir Shah, and my company is developing technology that's helping to fight breast cancer. Breast cancer is the most common cancer in the world, with 2.3 million cases expected in 2021. And with 685,000 deaths, it's also the most lethal cancer in women. Over a decade, more than 10 million lives may be lost. However, 90% of these lives can be saved with access to early detection and good treatment. I have lost my aunt, a friend, and a cousin to breast cancer. And I hope no one here has had to bear that kind of pain. These numbers are not just scary statistics, it's personal. In the US, breast cancer mortality is 40% higher in Black women than in white women. In India, my birth country, half of all breast cancer deaths are in women below age 50. And that's because majority of the cases come in late, way too late at stage 3 and 4. And there are similar challenges worldwide. From Europe to Latin America and from Middle East and North Africa to South Asia and Southeast Asia, over 1 billion women with limited access to early detection. And this is why UE LifeSciences was born. We are a growing women's health company that's developing innovative solutions for preventive oncology, solutions that are both effective and accessible. Ours is a diverse team of engineers, clinicians, researchers, public health experts based in the US, Malaysia, and India. Our products are engineered for scale and adoption across primary care, telehealth, and at-home markets. This is iBreast Exam. It's a handheld device that pairs with a mobile app. It enables frontline health workers to find and document tiny breast lumps virtually in any setting without any pain or radiation and in just a few minutes. This innovation makes early detection more personal. This innovation makes early detection more personal, more humane, and universally accessible to everyone. My company, LifeSciences, has clinically proven eye breast exam and is commercializing it in multiple markets simultaneously around the world. We have 8 distribution partners, and we are also excited to bring on board leading pharma company and medical technology companies to scale this globally. Already, we have sold 750 scanners and over 1.5 million scans.
Wow.
450,000 women have already received a breast exam, and we've helped identify over 200 cases of cancer. We've raised $6.6 million from grants, awards, and amazing angel investors. And now we need your support. We're asking for $20 million to help execute our business plan and accomplish our goal. I assure you, together, we can and we will get early detection to 1 billion women. Thank you.
Thank you.
So here, you sold 750 scanners.
Yes,
Over how much time, and what did that gross you?
So we started the sales after setting up our production facility and after FDA clearance. We now have clearance in 10 markets, and these sales have been made over the last 3 years.
What's the total sales?
We've sold products worth $3.5 million so far.
Can you tell us the major markets it's cleared in?
Sure. So iBreast is commercially available right now and through the regulatory process in Mexico, India, Malaysia, Thailand, Myanmar, Botswana, Oman, United States, Europe, and...
Okay, it would be short if I ask where it's not cleared.
Thank you very much.
What do they sell for each?
So iBreast exam is designed intelligently to provide access to early detection and not just equipment. The scanner retails for about $5,000, but it often is bundled in along with the purchase of many of these cartridges. This sensor has 648 capacitive sensors that can measure tissue elasticity in real time. We preload these sensor cartridges much like a printer ink cartridge with 100 or 500 scans.
And how much is the cost to the doctor's office and then ultimately to the woman?
So the iBreast exam to the woman would cost somewhere between $7 to $15.
So the price of a Starbucks latte.
Yeah.
Exactly. We want this to be at a fraction of the cost of other medical tests.
Wow.
And what we also provide is the mobile app, which is free. Any doctor can install it. And for health systems and ministries of health is a global cloud dashboard. So every scan is synchronized to the cloud so that they can take a look at who's positive, who needs to be referred to the follow-up. All of that happens on an AI-based cloud system.
Will the patient have access to all of this information, or is it just the doctor?
No, the patient is able to get access to their breast exams. First time ever, iBreast exam will create a digital documentation of the clinical exam so that when you go next year to your doctor, you and your doctor both know what was going on last time.
You're providing an app, right?
Yes.
How does your app change? Cell phones change a lot, and different types, and...
It'll update itself, just like any other app. We'll have updates. This will be a multilingual app as well, so women around the world will use it in their language.
That's amazing, Mihir.
Are you reinventing the mammogram with this effectively?
That's a loaded question.
Well, but that's very important
Yes.
because we all know that mammogram is not a very pleasant experience, don't we?
Our goal is not to replace the mammogram. Our goal is really to work with mainstream medicine collaboratively.
Will this replace the manual exam?
Today, I'm here to make a global unveil of our latest innovation.
Oh.
Really? And it's in my pocket. I present to you Selfie.
Come here, come here. Check this out.
This commercial model of selfie, which is designed for women to use at home, will make breast examination absolutely objective, easy, trackable, shareable, all of that. And it is powered with the amazing technology that we have in the hands of the care provider, in the hands of every woman.
That is great. How much does this cost?
Selfie will be $200.
Oh.
It'll be backed with a subscription model. Women will have access to their data. They'll be able to order BRCA gene test on it. They'd be able to get a second read of their mammogram with AI. They'd be able to measure their breast cancer risk. I mean, this is like nothing done ever before.
Brilliant. I am in such awe over what you've done. I really am. I now wonder how many other millions of people you might be able to early detect cancer. Where do you see yourself headed in that respect?
I really must show you one more thing.
Okay.
Wow.
More? There's more?
You're a box of surprise me here.
We had a mobile phone capable to do breast examinations. And so we converted it into a cervical cancer screening tool. This camera over here turns this mobile phone into a pocket colposcope. It allows care providers to take a picture of the cervix. That result is more accurate than a Pap test, an HPV DNA test, or cytology test. And so breast and cervical cancer together are 50% of all women's cancers, and we have a solution for that.
So if it was a cyst that was benign, it would say no right away, or what? What would you see if you just had a cyst?
It really needs to have a hard lump to push back.
But a hard lump isn't always cancerous. What result would you see?
Could I actually demo you the eye breast exam in real time? Would we like to see a functional demonstration?
That's a great idea.
All right, it's very simple. All I wanted you to do is put your finger directly in the middle of the sensor, and you will see the sensor respond in real time.
Yeah, look at that.
If you swipe your fingers across the sensor, just like a touchscreen, you will see your finger in real time.
If I remember correctly, you said that you have raised previously $6.6 million.
Yes.
Who are your primary investors?
So we have two major buckets from where that capital has come. 4.3 million of that capital has come from phenomenal angel investors. In addition to the venture capital, we raised $1.7 million in grants and awards. This is non-dilutive capital that has gone to the most riskiest parts of our business, which is research and development, clinical studies, things that investors don't really like to back so much.
Stop right there, because otherwise you are going to end up in too good to be true type of category.
How do you market this? How are you getting it out to all of these doctors and then ultimately to the women around the world who most need it?
As a small company, we haven't been able to put adequate resources to marketing so far. Having said that, we have currently an amazing partnership with Pfizer Pharmaceuticals. Pfizer is helping us get in front of ministries of health and large-scale HMOs to establish iBreast as the standardized tool across that country. In the United States, we are right now in advanced level of conversation with a global medtech player to bring distribution of iBreast exam to reach every single primary care provider and gynecologist in the United States.
Wow, that's impressive.
Miguel, what are the projected revenues? What is your exit strategy?
In the next 3 years, we are projecting $70 million in revenues.
Yeah, but the numbers do not add up, Miguel.
I am conservative, so I will say that.
Well, you're standing on the head of a unicorn. You shouldn't be conservative.
I rather...
If you want to dominate the world, you need to think really, really big. So...
iBreast exam can be available in 1 million clinicians' hands around the world.
I like that better. Come on.
And in terms of the consumer device, there are 1 billion women that are in need for an iBreast exam. You asked me for a projection, and I have always been an entrepreneur that likes to overperform.
What do you need to make this a company?
Capital, capital, capital. That is why I'm here.
So unless anyone has any other questions, Mahir, we're going to excuse you from the circle of money so we can deliberate.
I thank you.
Thank you.
Thank you for your time. I think I left nothing on the table. I think that this is a topic that's connected with many of them at a personal level. As I say, right, this is an opportunity to do phenomenally well by doing good. How can you look away from that? I guess I'm thinking about my dad. He's the reason why I'm here. This is everything that he'd want. I'm gonna go out there on a limb and say, I think we're gonna get every single one of them to say yes.
I love his purpose. The only thing I didn't like much is that he thought about 70 million. I was saying 70 billions with a B.
And Rosie, why isn't he projecting a 10x?
I do feel like I didn't get enough of his financial information.
Certainly.
But at the same time, I do think there's a lot of promise that this is such a global issue. But I just feel like I'm missing something.
He has the powerful investor, he has the technology, the patents, he has pretty much everything. Yeah. The only thing that I come to think when I see him being so modest, where we come from, like thinking too big can make you look delusional.
No, you're
exactly
right. You're absolutely right about that.
For that.
Are we ready to bring Mihir back in?
Bring him back.
Yeah. You're ready.
Yep.
Incredible presentation, and I commend you on what you are doing. It's really important. We're going to give you 60 seconds to give your final pitch to us and to all the investors around the world.
I'll never forget the day a woman walked up to me and said, "Thank you for saving my life. God bless you." And I can't really describe the feeling I had at the time, but that was enough motivation for a lifetime. You know, we can truly deliver the fighting chance women deserve against cancer. We have the team, the technology, the partnerships, and a plan. If I could borrow from the famous words of Dr. King, you know, this is the fierce urgency of now, and we need vigorous positive action. This is an amazing opportunity to do well by doing good. And I hope you consider that opportunity. Thank you.
Didn't even need 60 seconds.
And normally at this stage, we have a lot of possible concerns. This time we had just about zero, but the only consideration was, why aren't you already a unicorn?
That means a lot to me coming from you.
Welcome.
Thank you.
The only thing I'm not clear about is how you're going to market this. Other than that, I think this is incredible. Thank you.
Thanks, Lance. Thank you.
For someone who looks so young, you've obviously put a lot of blood, sweat, and tears into these products. I would have wanted a little bit more information on some of your numbers, a little bit more about your projections and strategies moving forward. I'll give it some thought.
Thank you.
I like what you're doing. The only thing that concerns me is your lack of ambition in terms of how fast you can get to the numbers.
Thank you.
Remember always that we need to look like the people that we are serving.
Yes.
We want to impact the lives of women. I think they should see themselves in your C-suite. Other than that, I have nothing, absolutely nothing negative to say.
Thank you.
Here, at this stage, we are supposed to give our opinion by stating the positive and the negative. That's pretty much the first time when I am struggling to find the negative. And I'm not finding, so I'm passing the word to Chris.
You're here because your father wanted you to be a doctor. All of us here were brought together because of the excitement of the opportunity to bring something to the masses that can impact their lives, and in this instance, save lives. It seems like a foregone conclusion, but before you get too cocky, we got to get down to business. I'm going to send this over to Waz, because Waz knows what's up. Waz, in or out?
I do things always jointly thinking of my wife and waiting for a text from her. Yes, we're in.
Well said. Thank you.
I am so in for this.
We'll make it happen. We'll make it happen. Thank you.
I'm in.
I love what you are doing. I want to support you financially. I want to help you with marketing. And most importantly, I want to help you recruit more women engineers.
Thank you.
You're going to be the first one I actually invest more than I ever have before.
Thank you. Thank you.
I'm absolutely certain that I'm going to be an investor, so I'm definitely in.
Thanks, Alex.
I mean, it's a simple, unmitigated yes. I would love to be in.
That's exactly what I was hoping for. Thank you.
11 out of 7, guys.
Golden unicorn.